You lace up your shoes every single morning. You walk your usual loop around the block or maybe the treadmill at the gym, and you feel good about it. You should feel good about it. Walking is one of the best habits a person over 60 can have. But here's the question almost nobody asks. If walking is truly enough, why do so many people who walk every single day still struggle to get up from a low couch? Why do their knees still feel unstable on uneven ground? Why does their balance still waver when they step off a curb? If walking alone built the strength your body actually needs, these problems would not exist. The uncomfortable truth is that walking, for all its benefits, is missing a critical piece of the puzzle. And one orthopedic surgeon has been telling his patients exactly what that missing piece is, because he sees the consequences of skipping it every single day in the operating room. Walking is what we call a low-load repetitive movement. It is wonderful for your heart, your lungs, and your circulation. But mechanically, your muscles barely have to work against any real resistance to move you forward. Your body adapts to exactly the demand you place on it, and a gentle stroll simply does not demand enough from your quadriceps, your glutes, or the deep stabilizing muscles around your knees and hips to meaningfully build strength or bone density. This is why so many lifelong walkers are still surprised by a stumble, still nervous on stairs, and still losing muscle mass year after year despite doing everything they believe is right. Before we get into the exercise that fixes this gap, I want to know something. Take a moment and comment below. How many days a week do you currently walk, and have you noticed your strength changing at all? I read every comment, and I want to see how many of you relate to this. And if today's video helps you, please subscribe, because we cover exactly these kinds of overlooked gaps in senior fitness every week. So what is the one exercise that closes this gap, requires no equipment, and according to orthopedic surgeons, builds more functional lower body strength in a few minutes than a long walk does? It is called the wall sit. Here is exactly how to perform it. Find an open stretch of wall, free of any picture frames or light switches in the way. Stand with your back flat against the wall, feet shoulder width apart, and walk your feet forward about 2 feet away from the wall. Slowly slide your back down the wall by bending your knees as if you were lowering yourself into an invisible chair. Stop when your thighs are roughly parallel to the floor, or wherever feels challenging but controlled. Your knees should stay directly above your ankles, never pushing out past your toes. Keep your back pressed flat against the wall the entire time, and breathe normally throughout, never holding your breath. Hold this position. If parallel is too difficult at first, simply do not go down as far. Even a shallow wall sit with your hips barely bent builds real strength when held correctly. Start by holding for 10 to 15 seconds, then push your back off the wall and stand up fully to rest. Repeat this for 3 to 5 rounds, resting for 30 seconds between each one. Now let's talk about why this single static hold can outperform a walk around the neighborhood when it comes to building real, usable strength. When you walk, your muscles contract and relax in a continuous cycle, never staying under tension for more than a fraction of a second at a time. The wall sit works completely differently. It is what's known as an isometric exercise, meaning your muscle generates force while staying at a fixed length, without the joint moving at all. During a wall sit, your quadriceps, hamstrings, and glutes are all under continuous, sustained tension for the entire duration of the hold. This sustained tension is precisely the kind of mechanical stress that signals your body to recruit more muscle fibers, strengthen the connective tissue around your knee joint, and increase bone density in your hips and thighs. Orthopedic surgeons frequently recommend wall sits to patients before and after knee surgery for exactly this reason. It strengthens the muscles surrounding the joint without subjecting the cartilage to the repetitive impact and grinding that walking, and especially walking on hard pavement, can produce. There is another critical advantage here that walking simply cannot replicate. The wall sit directly trains the exact muscle group responsible for the movement seniors fear most: standing up from a low seat and catching yourself during a stumble. Surgeons call this an anti-buckling response. When your knee suddenly has to bear unexpected weight, whether from a missed stair or a sudden shift in balance, it is the strength of your quadriceps holding that joint stable in that exact bent position that prevents a fall. A daily walk never asks your quadriceps to hold a bent position under load. The wall sit asks for nothing else. This is precisely the kind of targeted protective strength that determines whether a stumble becomes a recovered near miss or a trip to the emergency room. There is also a metabolic piece worth understanding. because the wall sit recruits such a high percentage of your largest muscle groups simultaneously and holds them under continuous demand. It elevates your heart rate and burns energy at a rate that a leisurely walk does not come close to matching, minute for minute. A short series of wall sits can deliver a more potent strength and cardiovascular stimulus in 5 total minutes than a 20 or 30-minute walk provides for those same muscles. This does not mean you should stop walking. Walking remains excellent for your circulation, your joints' general mobility, and your mental well-being. But pairing it with a few minutes of wall sits gives your body the structural strength training that walking alone was never designed to provide. Let's go a little deeper into what's happening inside the joint itself, because this is the part most people never hear explained. Your knee cartilage does not have its own direct blood supply. It depends on a process called imbibition, where nutrient-rich fluid is squeezed in and out of the cartilage like a sponge, but only when the joint experiences a healthy range of compressive load. Repetitive low-load movement like walking provides some of this, but a sustained, moderate isometric hold like the wall sit provides a deeper, steadier compressive signal that many surgeons believe supports cartilage health even more effectively, without the thousands of repetitive heel strikes that walking puts through the joint over the course of a long walk. This is one of the lesser-known reasons wall sits show up so often in post-surgical rehabilitation protocols. The muscle is being challenged hard, while the joint itself stays still and protected. If you are just starting out, please be patient with your body. A shallow wall sit, held for even 10 seconds, is a perfectly valid starting point. As that becomes easier over the next 2 to 3 weeks, gradually deepen the bend in your knees and extend the hold a few seconds at a time. There is no need to rush toward the deepest, longest hold right away. Consistency at a manageable level will always outperform pushing too hard, too soon, and risking discouragement or strain. Once the basic wall sit starts to feel comfortable, here is a simple progression surgeons often suggest to keep building strength without adding any impact. While holding the wall sit position, slowly lift one foot just an inch off the floor and hold it there for 2 to 3 seconds before placing it back down, then repeat on the other side. This briefly shifts your entire body weight onto a single leg, dramatically increasing the demand on that leg's stabilizing muscles, the same muscles responsible for keeping you steady when you step off a curb or catch yourself on uneven ground. Only attempt this once you can comfortably hold a standard wall sit for 30 seconds with clean form, and always keep a hand near the wall for light support if you feel unsteady. One final form note that surgeons emphasize repeatedly: never let your knees collapse inward during the hold, and never let them travel forward past your toes. Both of these put unnecessary shearing stress on the knee joint. If you notice either of these happening, simply walk your feet a little further from the wall or reduce how deep you sit until your form is clean. Clean form at a shallow depth will always build more real strength and protect your joints far better than a deep hold performed incorrectly. And if you ever feel sharp pain, as opposed to the normal burning sensation of working muscle, stop the hold immediately and check in with your doctor before continuing. You do not need to abandon your daily walk, and you do not need a gym membership or a single piece of equipment to close the strength gap that walking leaves behind. All you need is a blank wall in 5 minutes. Try this today, hold yourself accountable to those 3 to 5 rounds, and notice over the coming weeks how much steadier you feel standing up, climbing stairs, and catching your balance when it matters most. Your daily walk got you moving. The wall sit is what finally builds the strength to back it up.